There are four types of nerve injury: compression, laceration, distraction, and crush. The most common that we see in a therapy setting is compression. Certainly, carpal tunnel falls into the compression type of nerve involvement. The variation of involvement with a nerve injury is dependent on the amount of pressure and the amount of time. Most cases, we understand when the injury occurs in terms of, for instance, compression. We really don't know how much pressure is there. Certainly, we can base that off of symptoms using some of your common assessment tools, such as the monofilament testing or two-point discrimination. We can detect the amount of damage that has occurred. When patients actually describe loss of sensation that is significant to the point where it is a constant in feature, is when I have more concerns about the approaches that we are going to apply. When we work with a patient who's had a laceration and repair, we certainly can have a mixed results with that, depending on the size of the nerve and the location. Small digital nerves beyond the PIP joint are in many cases unable to be repaired. A patient is left with permanent nerve loss or nerve sensation loss. When nerves are damaged proximal to the PIP joint, somewhere in the hand, typically these can be repaired with a variation of recovery. They're typically left in a protected position, MPs in a flex position. And as far as length of recovery, traditionally a centimeter a week to 2 weeks, up to 1 inch per month for recovery time is plausible. But again, depending on the nature of the injury, crush injuries are probably the most limited in full recovery, and distraction injuries tend to be on the better side and falling more in line with compression type injuries. So when we separate nerve injuries, compression and distraction tend to have more favorable results. For obvious reasons, crush and lacerations having less favorable results, with crush probably having the worst results. Some of the problems that a patient can face is certainly hypersensitivity in the region of damage, and certainly loss of long-term loss of sensation, which will have to be addressed through compensatory means, typically visual inspection of areas that do not have an ability to detect sharp and dull objects specifically, and for any objects that are heat and certainly cold. Heat being more the likely to have the issues.